Unaona mambo yakibadilika, yabadilika kwa wema wako. Unaona mambo yakibadilika, yabadilika kwa wema wako. Unaona mambo yakibadilika, yabadilika kwa wema wako.
Haya. Asante sana. Your Excellency, the Governor of Gusii County, Honorable James Ongwae. Your Excellencies, the governors, distinguished guests, ladies and gentlemen, hamjambo. Hamjambo tena. Thank you very much. I'm very delighted to be here this morning and to see so many people from different parts of the Lake region gathered here at the Kisii University to talk about a very important sector in our economy, the health sector. I have a lot of respect for Professor Ngeri. I listened very carefully when he was talking here. And I know that he would have preferred to have been a Minister for Health in a devolved system of government. Because he will tell you that devolution works. In the old system, when he was the Minister for Health after there in Nairobi, he had to be minding all sorts of things. Something is not working somewhere in Kabarnet, somewhere there in Mandera, here in Lamu, in Kisii here. He had to attend to all those things personally as a Minister of Health. Now, with devolution, it doesn't have to. You need to talk to the governor. Things are okay. The only problem we have is the disconnect between the national and the county government. And that's what we want to fix. Ladies and gentlemen, when we met here last year, met at a forum similar to this in February of last year, we were at the County Entrepreneurship Summit. That is what took place here at this university. We were looking into how to improve and to unleash the economic potential of Kisii County in collaboration with its neighbors. I am glad to be here today for what I consider to be a continuation of the conversation we started by narrowing down today to a specific and critical aspect of the well-being of our people, which is the healthcare. Devolution was meant to take the services and resources closer to people. The most critical service Kenyans lack and badly need at the grassroots is affordable, quality healthcare. I wish to share my thoughts on some of the areas we need to prioritize in the next 5 years as we seek to join hands in delivering healthcare. At the pain of repetition, because I listened to some of the things that have been said yesterday, it will be like to try to emphasize some of those points. We need equity, universality, affordability, and equality in health sector. Equity and universality mean our expenditure in healthcare must prioritize the needs of the most vulnerable who suffer the largest burden of disease. This means prioritizing greater investment in access and protection measures for the poor. Improving equity and universality would mean some kind of affirmative action to reach the poorest and minimize disparity in access to healthcare on account of gender, social status, and geographical barriers. In this regard, we need to come up with a clear plan that informs, clarifies, and strengthens the role and hands of the county government in shaping the healthcare in all its dimensions. These dimensions include investment in organization and financing of healthcare services, prevention of diseases, and promotion of good health through cross-sectoral action, access to technologies, developing human resources, building the knowledge base required for better health, financial protection strategies, and regulation and legislation for healthcare. As we speak, Kenyans face extraordinary challenges with regard to accessing quality and affordable healthcare. Our people, especially those in rural areas, live one ailment away from the death or bankruptcy. The poor are the hardest hit naturally, but everyone is feeling the pain, including the middle class. The disease burden in the counties represented here is humbling, as has been ably articulated here during this conference. We have high rates of infant and child mortality, HIV, AIDS, and malaria, in addition to ailments like upper respiratory tract infections and pneumonia. Lifestyle diseases are rising across the country. These are diseases which come with affluence. The worst hit are those without health insurance. What these realities mean is that the time has come for our country to bring about a complete transformation of the health sector. Luckily, healthcare is an evolved function. This creates room for new thinking away from the old mindset that has bedeviled this critical sector since independence. I want to share some thoughts on what I believe counties could do going forward to ensure evolution delivers with regard to healthcare. I wish, however, to emphasize that some of these measures will require the goodwill and cooperation of the national government, which is currently lacking. A recent survey by the University of Nairobi found that about 17% of those who reported illness did not seek health care. More than 50% quoted lack of money as the main hindrance why they did not seek health care. Among those who utilized the health care, 12% experienced catastrophic expenditures, and some 4% of about 2.5 million individuals were impoverished or made poorer by these payments. The poor experience the highest incidence of catastrophic expenditures. The econometric analysis reveals that out-of-pocket expenditures are a deterrent to health service utilization, are significantly and positively associated with catastrophic expenditure and with household poverty. Time has come for Kenya to roll out a medical scheme, including health insurance, that is capable of delivering quality health care services to all our people. Something akin to Obamacare in the United States. When Mr. Trump tried to repeal or change Obamacare, he found it very difficult because it became too popular with the people in the United States. In collaboration with the national government, counties need to embark on deliberate programs that raise the quality and affordability of healthcare, that increase the number of people with medical insurance. Time is long overdue for publicly financed health insurance schemes that will improve access to hospitalization services and protect households from high medical expenses. This will shield our people from the fraudulent measures that some hospitals and insurance companies have resorted to lately. And you see a number of people coming to you with prescriptions because they don't have money to go and buy these drugs. This will shield our people from the fraudulent measures. We must bridge the gap between the rural and urban population with regard to access to affordable healthcare facilities by building and managing hospitals and clinics in areas where majority of our people live. We should aim at ensuring that in the next 5 years, the big cities and urban centers won't be the only ones with access to excellent health facilities, and people won't have to travel from their villages in search of good doctors and hospitals. And I am very delighted to witness the effort being made by the counties in this region to bring Medicare affordable and accessible to the people. We must change the pattern of majority and the best healthcare facilities being located in major cities and urban centers where majority of population live in rural areas. This is a task county governments must give priority. But access is not enough. One area in which we cannot afford to continue with the policies of exclusion is healthcare. As costs of Medicare rise, affordability must be addressed. We need medical systems and services that cater for the entire population, not just a targeted subgroup. The task of providing health care for all cannot be undertaken by the government acting alone. It requires participation of other sectors in the communities. It will also require the widest levels of partnership with academic institutions, not-for-profit agencies, but for commercial, private sector, and healthcare industry. Counties, therefore, need to create space for private sector to be involved in driving the growth of the country's healthcare sector. We also need to forge partnership with local and foreign learning institutions. Our counties also need to partner with financial institutions to start specialized finance options for those looking to invest in the sector. We need to press banks to offer customized solutions to fit the needs of the doctors, diagnostics centers, hospitals, and nursing homes in the counties. This will enable more people to have access to great healthcare in the years to come. To meet the growing and changing healthcare needs of our people, our county government must be on the forefront transforming the health sector through investment in research, innovation, and technology. Some of the technological and innovative measures we could explore are investment in the e-health to provide effective, economical, and timely healthcare services to all individuals, and especially to those people who have little access to healthcare services. With e-health, citizens should get things like lab reports and doctor's appointments much easier and faster. Innovation and technology should see our counties develop e-hospital applications online registration system that allows patients to skip the hassles of registration and other formalities required at the hospitals. As we pursue this, we also need to create an infrastructure that will make it possible for medical personnel from advanced countries who wish to work in our countries to be able to do so with ease. Our aim should be to ensure low cost of treatment, quality healthcare infrastructure, and the availability of highly skilled medical personnel in public hospitals. Our healthcare sector is divided into the private sector and public sector. Private sector hospitals are frequented more often than government hospitals because they provide better services to patients. I want us to reverse this pattern in the coming 5 years. With appropriate investment, we can make government hospitals the facilities of choice for our citizens, or at least put them at par with the private ones. Overall, our overall aim should be to make Kenya a top destination for medical tourism in sub-Saharan Africa. We have seen many hiccups paralyze the health sector these past 4 years. For instance, governors were made to sign for health equipment that was clearly not a priority. Those hiccups were clearly the source of the standoff between doctors and the government that paralyzed the health sector. Going forward, we must seek ways to safeguard counties against such intrusions that turn upside down their priorities and their ability to deliver to the electorate. I wish to end by talking briefly about the recent doctors' strike. It was a product of those many hiccups brought about by lack of clarity on the management of the health sector. The task force on strengthening of the health service delivery, established in the year 2012 under my direct direction as the Prime Minister of the Republic of Kenya, was part of a return to work formula following a doctor's strike over a variety of grievances. So this is an issue I was very conversant with because I handled it as a Prime Minister. The task force came up with key building blocks for successful health system, including availability and functioning of diagnostic equipment, human resource management and capacity building, compensation of registrars on training, stewardship and management of public health institutions, financing of the public health sector, and performance management in the Ministry of Health. These goals remain valid. There remains a significant need for the establishment of a Health Service Commission to help us realize these goals. A Health Service Commission would free counties from the heavy responsibility of human resource management and allocation, while allowing them to focus their resources and energies on managing health facilities, providing pharmaceutical services and medical supplies, and ensuring the availability and functionality of diagnostic equipment. A Health Services Commission would further oversee capacity building. There are hundreds of unemployed Kenyan doctors looking for work. It is therefore disappointing that the government is seeking to recruit 500 foreign doctors to serve in our hospital. We need to invest in resolving our policy problems in a way that leaves our citizens motivated and willing to serve our country. Over the weekend, I suggested that all governors ought to immediately honor the terms of the return to work formula signed with the Kenya Medical Practitioners and Dentists Union and pay the health workers their arrears from December. I am pleased to announce that this has been taken up by the Mombasa County government. I want to appeal to the county public service boards in all other counties to follow suit and pay doctors so that we can put this crisis behind us. This is money that was already budgeted for. And if they had been there, they would have been paid. Directed by the Ministry of Health to withhold pay amounts of bad faith that can only poison the waters, leading to poor service delivery for an inch. With these measures, we can look forward to a healthier Kenya in the coming 3 years. I wish you best of luck. Asanteni sana.